5-HT1A agonist in treatment of the anxiety disorders. Anxiety disorders can be treated by different types of drugs like benzodiazepines. These drugs are used for the acute treatment. Similarly, these disorders can be treated by the drugs like SSRI or SNRI, selective serotonin reuptake inhibitors, otherwise selective norepinephrine reuptake inhibitors. And another category of drugs are the 5-HT1A agonists. All these category of drugs are used in chronic treatment of the anxiety disorders. So one of the 5-HT1A agonists is the Buspirone. Now 5-HT, which is synthesized in the nerve terminal, is going to be stored into the synaptic vesicles, and it can be released into the synaptic cleft by a process called exocytosis. The released 5-HT mediators then can act on the postsynaptic receptor, which produces the excitation of the membrane, leading to development of the anxiety within the CNS. Now these released mediators can also act on the presynaptic receptors. Presynaptically, 5-HT1A receptors are present, which can be again activated by the released 5-HT. Now 5-HT, which is released during the exocytosis, can bind to these 5-HT1A receptors, which then going to inhibit the exocytosis. So 5-HT1A receptors are auto-inhibitory nature. They will decrease the further release of the 5-HT. So when these receptors are occupied, they will inhibit the excitation in the postsynaptic membrane, thereby they decrease the anxiety. So drugs acting on these receptors like Buspirone are having advantage in the treatment of the anxiety. So Buspirone acts on 5-HT1A receptor as agonist, thereby decreases the anxiety. Is Buspirone superior over benzodiazepine? So benzodiazepine and Buspirone, which should be used? Buspirone is actually not superior, but it is more preferable than the benzodiazepines in chronic conditions. Benzodiazepines are the well-known drugs which are used for the anxiety disorders. They are having the advantage that they produce immediate action. Hence, these drugs are used in the acute conditions. But benzodiazepines are also having disadvantages like motor side effects, sedation, and loss of memory. These drugs produce anterograde amnesia, that is a loss of the current events, which is more problematic when drug is used for a long-term period. These side effects are not shown by the Buspirone, so Buspirone is preferred on long-term treatment. So Buspirone is having some advantages like it does not produce motor side effects, and it does not produce a significant sedation like the benzodiazepines, and it does not produce a loss of memory, which are problematic on long-term treatment. But only one of the disadvantages of the Buspirone is it shows the onset of action very slowly. It can show the action after 2 to 4 weeks of the treatment. So Buspirone cannot be used for the immediate action. It can be used for the chronic treatment, and it shows the pharmacological action after 2 to 4 weeks of the treatment. In this way, Buspirone plays a key role in the chronic treatment of the anxiety disorder, but the pharmacological action is produced only after 2 to 4 weeks of the treatment. In this way, 5-HT1A agonists give a promise in the treatment of the chronic anxiety disorders. Thank you for watching this video.